Hi, good evening. My name is Mahoney. I'll be your nurse practitioner student today. We're going to be doing a full physical exam. For the purposes of this video, you can leave all your clothing on. We won't expose your skin as we normally would in the clinic. Do you have any questions before we start?
Nope.
Awesome. Okay, so first I'm just going to be taking a good look at her, how she's interacting with me, talking with me. She seems very normal affect. She's smiling under her mask. She's very well groomed and well dressed. Does not appear to be in any respiratory distress or other issues pertinent. So first we're just going to do a set of vitals in the clinic, but I'm going to count your radial pulse for 15 seconds and times by 4. So 15 seconds has lapsed, and it's about 60 on the heart rate. I'm also going to compare her radial pulses bilaterally. They're +2, and they are equal. And I'm also going to be taking a look at her, and I'm going to be leave my fingers on her wrist, and I'm going to count her respiration rate for 30 seconds, and then I'm going to times by 2. And great, we've got a respiration rate of 14. And so I'm going to also take a look at her skin right now. She's warm and pink and well perfused. I'm going to check her cap refill on her fingers, the cap refill on the toes. That looks good. I'll check her dorsal PDS pulses while I'm down here, and her post-tib pulses as well. Great. And those are both +2 and equal bilaterally. So now, also with looking at her skin throughout the whole exam, we'll be looking for any lesions, bumps, lumps, rashes, anything that we would concern for cancer. Any issues with your skin at all? Anything new? Okay, good. So I'll start by just examining her head. So it's a normal cephalic, very round. I'm looking at the hairline. Hair pattern is evenly distributed. I don't see any lumps or bumps or anything visual. No lesions of any kind. So I'm just going to touch you here in your scalp. Feeling for any masses, any pain at all?
Nope.
All right, awesome. And then I'm just going to take a look at your frontal sinuses and any pressure here.
No.
Okay, good. And in your maxillary, any pressure here?
No.
Good. I'm going to feel the other bones of the face. And I'll have you open up your jaw for me. Good. And close it tight.
Mm-hmm.
And then open up your jaw again and move it side to side. All right, good. TMJ is intact there. And we're going to look at all the lymph nodes. So we'll do the occipital lymph nodes. Elevating for that. The post-auricular lymph nodes. The pre-auricular lymph nodes. Tonsillar. Submandibular. Submental. And we're going to do the anterior superficial clavicular lymph nodes, and then the deep. And same thing on the other side. Superficial to start, and the deep. And then we'll do the post-cervical superficial lymph nodes, and then deep. And same thing on the other side. Superficial to start, and deep. And then we'll do the supraclavicular lymph node check as well. I don't notice any enlarged lymph nodes or anything at all issues there.
Sounds good.
And we're also going to, I'll just have you pull down your mask real quick, and I'll have you squint real hard, and then open up your eyes real wide and raise your eyebrows, and then smile real big, and then frown, and then puff up your cheeks. Beautiful. All right, testing for that cranial nerve 7.
Mm-hmm.
And I'm also just going to, while we're here, I just want you to close your eyes and tell me when you're touching.
Mm-hmm.
Yep. All right, awesome. So that's testing cranial nerve 5. And then we're going to test cranial nerve 11.
Mm-hmm.
So I'm going to have you look sideways into my hand. Good. And look sideways in my hand. And then shrug your shoulders. Good. Awesome. Totally intact. And then we'll also check for neck mobility. So we'll have you do some extension. And then forward for flexion. side to side. Beautiful. And then ear to shoulder. And the other way. Good. Any issues or pain there?
No.
Good. And then both sides were all equal bilaterally. Normal finding. So we're also going to take a look at the neck while we're here and visualize the trachea, which is midline, and I'm just going to feel too as well. And I'm just going to step behind her and feel for the thyroid. Good, and then and swallow. Good, and no masses noted, no enlarged thyroid there, so everything's normal. Then we are going to move on to your eye test. So we're going to look for the perla, cranial nerves 2 and 3. So first I want you to look at that wall behind, and then look at my finger, and follow the finger. I see that her pupils are constricting for the accommodation. Now we're going to do a direct pupillary reflex. I'm going to shine your eyes, lighting an eye. Beautiful. They both constrict, and now we're going to test for consensual reflex, looking at the other eye. Good, and it constricts. And good, and constricts. And her pupils are round and equal, and about 3 millimeters at the moment. And then I'm also going to test cranial nerve 2, so I just want you to tell me when you can see my fingers moving, so look right at my nose.
Now.
Beautiful.
Now.
Awesome. So that is equal on both sides. Beautiful. So we're going to do testing cranial nerves 3, 4, and 6. So I'll just have you take a look at my finger and just keep your head straight looking forward, and then just follow the finger with the gaze. Good. Awesome. And no nystagmus noted, and she's able to follow very well. Then I'm just going to take a look at your eyelids. I'll just have you close. I'm just going to feel those for any masses. No obvious edema or redness or lumps or bumps or anything. And then you can go ahead and open your eyes. I'm going to pull your eyelids down, seeing that your conjunctiva is nice and pink and your sclera is nice and white. And the cornea looks intact to me. Looks very healthy. So we're going to pretend this is a scope. So I'm going to come in with my right eye, looking for that red reflex. And there we got it. And then so this is a right scope. We'd be coming in here looking at the optic disc in the back of the retina. Not noting any hemorrhages or issues there. And coming in on this side with my left eye. Imagine we got the red light reflex there, and then we're coming in, and we're looking at her optic nerve and the retina, and no noted hemorrhages there. Good, and the red reflex was also equal bilaterally, which is also great. Any issues or changes in your vision at all?
No.
Okay, good. So next we're going to inspect the ears. So we're looking for any bruising or signs of battle signs are there. Any pain at all in these areas? Good. Any pain when I touch it here? Any tragus pain there? Nope. Awesome. And I'll just do the same with the other side. No bruising, no issues. Any pain at all when I touch it here? Nope. The tragus. Feeling all the ears, and they are equal bilaterally, both nice and pink. So we'll come in. And just pulling up the ear, and we're able to visualize the canal. It is nice and clean, and I can visualize the tympanic membrane. It is silver and a good pearly gray with a good light reflex. And same thing on the other ear here, just pulling back. And I can visualize the canal. Everything looks great, and again, silver and pearly with the tympanic membrane intact. No obvious signs of bulging or issues. Any changes in your hearing at all? No. All right, I'm going to have you close your eyes for me real quick and just raise the hand of the ear that you hear my fingers. Great. Awesome. You can open your eyes.
Okay.
So I'll just have you pull your mask on just so to expose your nose. And I'm just going to touch your nose here. I can visualize already that it is nice and straight and uniform. Any pain or tenderness there? All right, I'll just have you breathe in. Good, and breathe in. Just testing the pain and see if there's any differences there.
No.
Good, and I'm just going to take my little light, shine it in. Looking at the areas of the nose, everything is a nice pale pink. Any changes in smell? No loss of taste? Awesome. And her tubernates look good, and there's no signs of any discharge. Mucosis looks healthy. And good. So now for the mouth, I won't use a tongue depressor because of COVID, but I'll just have you open your mouth, stick out your tongue, and say, ah, ah. Awesome. I see that the palate is intact and that her uvula rises normally and is big line. The fact that she's sticking out her tongue is a good sign, and now move it side to side. Good. Awesome. And that's testing cranial nerve 9, 10, and 12. So also when I was in there, I could see that her teeth looked normal. Any teeth pain or issues chewing or swallowing? Yeah, teeth looked great and intact. Her gums looked healthy. The gingiva was great. The tongue was nice pink. You could see her taste buds, palate intact, and the pharynx was nice and pink. Yes, now we'll just go to inspect the back. So I'll just have you just swing your legs around to see your back towards the camera. So we're looking for symmetry here. Nice, good alignment. I'm just going to palpate, touch you over. Just let me know if you have any pain over these spinal processes here, all the way down. I don't know any masses or any issues there. And I would be looking at her skin, noting any hematomas or visual deformities. And then I'm going to palpate again. Just let me know if you have any pain. Any issues there?
No pain.
All right. Good. And then I'm also looking at the curvature and the alignment. Now I'm just going to watch her take a deep breath, looking for symmetry there. So take a nice deep breath. And out. Beautiful. I can see that the chest, the back expands evenly across. And I'm just going to awesome. All sounds great. Just checking for the sound. I can hear the perfect. Oh, and then tactile premises, I want you to say 99 for me.
99. 99. 99. 99.
Okay, good, and I was able to feel that evenly across both lung fields, hopefully meaning that there's no fluid accumulation there. And I'm going to listen to your lungs here on your back. All right, so just take a nice deep breath in and out when you feel my stethoscope touch you. Beautiful. All right, lungs were clear and equal across throughout. And then I'll just have you swing your legs back around so you're facing the camera there. All the way around. Yeah. So same thing, looking for the chest expansion on the front here. Seeing that it rises equally. That's great. And we're also going to move on and look at the heart as well. So I'm going to palpate for the maximum impulse and apical impulse. So I'm just going to actually have to touch you underneath your breast here. Good, and I can feel the maximum impulse about right here. And I'm going to touch you again in the middle here. Okay, feel about there. And here. Good, and I can't feel any thrills either, which is great. Or lifts or heaves. So I'm going to listen to your lungs first on the front and then listen to your heart sounds.
Mm-hmm.
So same thing, just taking a nice deep breath in. Wonderful, and lungs are clear and equal throughout. And so now I'm going to listen to your heart sounds here. So first I'm going to find your sternal notch there, and we're going to listen to the aortic, and now the pulmonic, the secondary pulmonic, the tricuspid, and the mitral. Wonderful. I could only hear S1, S2 sounds. Everything was equal and regular. Sounds great.
Great.
So for this part, we're going to actually have you lay down as well.
Lay back.
Yeah, best of your ability. How's that?
Great.
All right. So I'm gonna listen to your heart again, but also right now I'm just looking for any jugular venous distension and the jugular venous pulsation. And I can see it here, as well as here. Awesome. And we're going to, usually it could be at a 45-degree angle, and then I would lower it until I could see it, but since we don't have a fancy table, this is what we're working on. So I'm going to listen to her heart sounds again, in the same areas, finding that sternal notch again, listening to the aorta, the pulmonic, secondary pulmonic, the mitral, the tricuspid, and the mitral. Awesome, and everything sounds really great, and I'll keep you right there just for a second because we're going to do a little bit of an abdominal observation here. Normally we'd have the skin exposed and we'd be, again, looking for any lesions, lumps, or bumps, any signs of hernias. I could have you just tuck your chin a little bit for me. There you go, and then down. Mm-hmm. Just checking to see if any hernias popped out with the abdominal activation. So I don't see any bumps or masses or any visual hernias. There's no bruising or rashes noted at all. So I'm going to first listen to all four quadrants. Wonderful, and you've got hypoactive or normoactive bowel tones in all four quadrants. And now I'm going to listen for any thrills noted along the aorta. Good, and so now I'm going to palpate. So just let me know if you feel any pain at all. And I touch it here, just light touch. Looking for any masses. No, it feels good. I'm just going to do a little bit firmer touch, a little deeper palpation. Any uncomfortableness there? No. Okay. And everything feels symmetrical throughout. And I'm just going to percuss your quadrants as well, looking for tympany or any dullness. Good, and mostly tympany noted there, which is great. Okay, you can go ahead and sit up. Okay. So any issues with bowel movements or changing in eating habits, any rapid weight loss or gain? Nope. All right, awesome. So now we're going to move on to her lower extremity observation. So first of all, I'm just kind of looking at her legs. I don't notice any deformities or masses. Any issues walking or moving or joint pain? No. All right, so I'm just going to lightly touch you here. Feeling for any masses, any knee effusions, checking for edema, especially along the shin, and none is noted. And looking at the feet, They're nice and warm and pink. You're going to check the pulses, looking for any, especially any pressure ulcers or issues on the toes or feet, and especially on the bony prominences where you don't notice anything. And feet look great. And we're looking also for the muscle bulk is symmetrical, no obvious joint abnormalities. Looking at the skin, it looks good, and we already checked the cap refill. So next we'll go on and check your reflexes. So I'm just going to hold your arm here. Checking the bicep. And tricep. And the brachial radial. Good. The other side. Bicep. Good one. The tricep. And the brachial radial. Good. Gonna check your flatellar. Good. And your Achilles. Beautiful. Awesome. And I'll check, I'm just going to touch the bottom of your foot to test your plantar reflex as well. Just keeping your foot relaxed. Good. We just want to make sure that our toes are not splaying upwards and out. So noting a positive Babinski sign. And now I'm going to have you just go copy me here. Good. And then toe touch with your this foot. Good. And other foot. Good. Testing for her rapid alternating movements, and they both looked even and easy. Now we're going to go like this. Good. Awesome. And then I want you to look at I want you to touch my finger and then touch your nose. Good. Wonderful. All right. So the finger movements was testing the repeating movements, and then the pointed movements was the finger to nose. And we're also going to test the pointed movements by taking your heel to your ankle and then move it up your shin and back down. And other side. Heel to ankle. Beautiful. Okay. And really quickly, we're going to check your gait. So I'll just have you stand up, looking for balance. Looks like she's got great posture, able to move. And yeah, there's been no injuries, muscles, everything's good. Okay, I'll just have you walk to that table and back. Good, and back. And then I'm going to have you turn around, and we're going to do heel to toe, walking the line. Good, looking at her balance there, which looks really great. Good. And then we'll just have you stand here, and I just want you to close your eyes. Just a tiny sway, which is normal, but great balance. All right, open your eyes. Good. All right, you have a seat here. Any questions at all today? No. Awesome. There's just going to test your sensation of sharp and dull. Okay. So with your eyes open, so this is going to be sharp, and this is dull. Okay, so just close your eyes and tell me what you feel.
Sharp, dull, sharp, dull, sharp, dull. I think dull.
Yeah.
Sharp, dull, sharp, dull, sharp, dull.
We're going to go on your feet here.
Dull, sharp, dull, sharp. Do that one again. Dull, sharp.
Awesome. All right, so that looks intact. Just checking here that we've got everything on yet. Everything looks great today. Glad you're keeping healthy in these times. Yeah, we did look at her nails, and I just wanted to note that they are pink. No blue or cyanosis noted at all. here.
All right.
All right, thank you so much.
Thank you.
All right, you have a great day. I'm just going to gel out here.
Nice to meet you.
Yeah, take care.